This nursing mindset video is about vital sign assessment. Vital signs are often one of the first assessments nurses perform, but they are much more than numbers to document in the chart. Vital signs help us understand what is happening inside the body. They provide important clues about temperature regulation, perfusion, gas exchange, pain, stress, hydration, and overall patient stability. The nursing mindset begins before you ever pick up a thermometer or blood pressure cuff. It begins with the patient. Before obtaining vital signs, perform hand hygiene, introduce yourself, and verify the patient using 2 identifiers. Explain the procedure so the patient knows what to expect, and always maintain privacy and dignity throughout the assessment. Next, ask yourself, is there anything about this patient that could affect how I obtain these vital signs? For example, has the patient recently eaten or had a hot or cold drink before an oral temperature? Does the patient have a limb alert, dialysis fistula, or history of a mastectomy that affects which arm should be used for blood pressure? Is there nail polish, poor circulation, or another factor that could affect pulse oximetry? Is the patient anxious, in pain, or has the patient recently exercised? These assessment questions help you choose the safest and most accurate technique. Now you're ready to begin. When we assess temperature, we are evaluating the body's ability to produce and lose heat. When we assess pulse, we evaluate the heart rate, rhythm, and strength. When we assess respirations, we observe respiratory rate, depth, rhythm, and work of breathing. When we assess blood pressure, we measure the force of the blood against the arterial walls. And when we assess oxygen saturation, we estimate the percentage of hemoglobin carrying oxygen. Notice that every vital sign tells us something different. Together, they create a picture of the patient's condition. As you perform each assessment, accuracy matters. Choose the correct equipment. Select the appropriate blood pressure cuff size. Follow the 2-step method when obtaining a manual blood pressure. Count respirations without telling the patient. Select the appropriate temperature route. And remember, one of the most important lessons from this course, assess the patient, not just the monitor. A pulse oximeter or automatic blood pressure machine provides useful information, but it never replaces your nursing assessment. Here's another important nursing mindset principle. Know the patient's normal. Spot the change. Save lives. A single vital sign gives you a snapshot, but trends tell a story. Always compare today's findings with the patient's baseline and ask yourself, does this make sense? Is this expected? What could be causing this change? Finally, remember that obtaining vital signs is only the beginning. If you find an abnormal value, don't simply document it and move on. Reassess, confirm the finding, evaluate the patient, report significant changes when appropriate. Those actions protect your patient and guide the next step in care. That's what nursing mindset is all about. You're not just collecting numbers, you're recognizing cues, identifying changes, and using clinical judgment to keep your patient safe. Remember, vital signs don't diagnose, they guide. Every safe nursing decision begins with the right mindset. So keep developing your nursing mindset.